on my so-called journey of vision, and which is something that I always have been very passionate about. And I should actually say our journey of vision, not my journey of vision, but anyway, it doesn't matter. Yeah. And if you look at the situation in Nepal, the landmark of Nepal's eye care was in 1981, when a national survey was done to find out the magnitude and distribution of blindness. And this was done very, very scientifically, very well quoted around the world as a national survey. And the essence was that we found that almost 0.84% of the population was blind. And interestingly, 80% were avoidable. And of that avoidable blindness, more than 80% was because of cataract and its sequelae. The situation in 1984, when I, like most of you young orthopedic surgeons, just came back from my residency program, I was very frustrated to see the results of the cataract surgery being done with intracapsular cataract extraction, being given very thick glasses. And it's where you see extreme incoordination because of wearing cork bottle glasses. If for us, a country full of geographical, turbulence and topography, ups and downs, you need very good eyesight. Wearing a very thick glasses was almost impossible. And also 60% of the patients who were examined during the survey were found without glasses, thus functionally blind. And because of the lack of precision, microscopic precision, the complications of the surgery were very high. And we found that about 6% of the cause of blindness was because of complications after cataract surgery. So that was a very grim situation of the status of cataract surgery at that time. And you saw that complications were very high. And because of that, the fear of surgery was also very high. And visual outcome was very poor. You can see it. Look at this lady looking through a operated eye with the broken glasses. And that was a scene that we used to have those days, So the purpose, that's where I wanted to, it's very important that we have a very clear purpose in our life. And our purpose was to see that we can come out with an eye care, which is extremely high quality, eye care, which is affordable. Make sure wherever we practice, make it affordable. And in a country like ours, it's important that we make it accessible. And finally, it's very important that we can sustain consistently over the period of time. And our mission at that time has been to provide modern cataract surgery to the needed community, which is sufficient in terms of numbers, successful in terms of quality, sustainable. And this is our mission. So I wanted to let you know, you need a purpose and you need a mission. So, and then you go and look at the barriers. At that time, the barriers for us to get to the purpose and our mission was the cost of high quality intraocular lenses, adaptation of good quality surgical technique, useful, appropriate for a situation like ours, cost and complexity of the equipments. These are the barriers that the good quality modern cataract surgery were not being able to be provided for the community in our context at that time. And cataract surgery, as you know, visual outcome should be same standard for poor and rich. That's always been our philosophy right from the beginning. And there should be no financial barrier, no geographical and social barrier, very important for our country. And we started, sort of working around and, trying on. Those days, operating microscopes was beyond our reach. So we started using the eyepieces of the lab microscopes, fitting it, putting innovative side lamps, and turning it into a microscope with pseudo-coaxiality. And we did some pilot study, and this is a surgery which has been done in Charang of Mustang. And you can see that the intravenous the irrigating solution into the eye has been is hanging through a gauge. This is in a little veterinary clinic, and you can see that our guide is looking over the head of the assistant. Anyway, in 1992, some leaders of the community, very positive thinking leaders, we conceptualized the concept of Tilganga Eye Center with a seed fund of about 28,000 rupees. And with a little assistance for a small organization that I had established when I was in Australia, Nepal Eye Program Australia, which later on, went into a transition and converted into the Fred Hollows Foundation, which is a very big organization now, going all around the world. And this was the group, and our group was led by the late esteemed litterer, Mr. Jagdish Gimire, and some of our friends are here, and very nostalgic memories of those days. And I always thought that building an institution is not only brick and walls. It's very important that the software, not only the hardware, the software is so important. If you don't have proper sustaining software, it's not going to run. So I think we need to have people, a workforce who are imaginative and innovative. You need to have a very strong team, a good base, and of course, a positive advocacy. People with positive advocacy is very important. And we opened Tilganga in 1994, 7th of June, to deliver high quality eye care and a manufacture intraocular lenses, and a very strong community program, a good academic and training, and then a research component. So some of the training programs being done in Tilganga. And we started looking at the barriers, the early barriers, one by one. And we came to, after a lot of struggle, a lot of obstacle handling, challenges, we came out and modified. And then finally, we were able to manufacture high world-class intraocular lenses in Nepal with the help of the Fred Hollows Foundation. And cost those days was more than $100 per unit. And that was a money that average people in Nepal could hardly afford for one case. And as with time and about 2 to 3 years of our hard work, the cost of these intraocular lenses came down to less than $4, which is about $2 now. And of course, you need to have a continuous dynamic into newer products. This is a technology. The important thing is, after this was possible, type of surgery of this, modernity, this precision now came within the reach of poor community. So the target population went into millions from few hundreds. I would say a great public health landmark. And we were able to, stick with the quality assurance. And we continue to stick with the quality assurance, and every lens that comes out of the lab is so good that you can put in your mother's eyes. And until now, we have distributed about 6 million lenses to almost 80 countries around the world. And this is going on. The second thing is to adapt and modify the surgical technique so that it is appropriate for the conditions in our context. It took us nearly 5 years to simplify, adapt, and test, and train. And then, standard operating manuals were published, and we were able to internationally publish this in journals and keynote speeches. And with the Fred Hollows Foundation and the Himalayan Cataract Project, the surgical technique, the surgical delivery system became a very popular international Nepalese system. So the idea was to have it high volume. Nepal was one of the pioneer countries to start in the developed country to start an ambulatory cataract surgery. We started in 1994. And it wasn't easy, but we were successfully able to integrate ambulatory surgery. Those days, before that, cataract surgery means, for somebody to be in the hospital for about 10 days. Can you imagine that now? Which is not the case now. And, it was important for us to transition into this. And we also applied it as a model of cost recovery. And, maintaining the quality, we allowed people who could afford to pay and subsidize to people who cannot pay. Surgical modification and production line approach for high volume community cases. And also at the same time, cost of other equipments. We did a couple of, research and development for large organizations and companies in terms of YAG lasers, in terms of operating microscopes, and now for phaco machines, which are part and parcel of some of the philanthropic works around the world. And our commitment to community right from the beginning had been but second to none, absolutely strong. And at the same time, we started training doctors in Vietnam, China, Bhutan, Thailand, DPR, Korea, Indonesia, Myanmar, Ethiopia. And we had trainees from so many countries around the world because this was a system which was very successful in many developing countries. So we have doctors coming from both developing and developed countries. The other thing that we wanted to share with you is the success we had with the eye bank in retrieving cornea. We did some out-of-the-box things like, setting up a cornea excision center in Pashupati Ghat. Nowhere in the world this is seen. And this was very innovative, and this is how we started in the beginning. But now, at present, we can very, very proudly say that in Nepal, we are self-sufficient for the need of corneal tissues and for the need of intraocular lenses. I say that with pride. Now I like to just share with you to translate what we have done over a period of 2 to 3 decades, and especially to younger surgeons. I wanted to share some of my feelings from my heart. It's very important that you understand and you clearly mark your purpose. And it's important purpose, whether you call it purpose or vision. That's very important. And it's extremely important that you have clarity in the purpose. More clarity, better you are. And it's important that it needs to have total engagement. It's just not something that you just touch and then break. You have to continue to engage. And what we are in Silganga is probably one part is engagements. And then the third that I value very highly, and I like to consistently advocate for this, is integrity. Integrity is very important, whatever you do, because integrity is going to pay you, even if it is difficult in the early period, but it's going to, for a long, long, long run, is going to pay you. And patients in Nepal are not fool. They come to see you after a lot of research. And your integrity is a great plus point besides your technical excellence. And of course, impact for the purpose is also very important. How much of impact are you going to do? Is it an impact that's going to create welfare for people? How many people? So many people for the country. So the impact is very important, I think. The other thing that I would like to is a very, very important component of our daily activities, our life, and the way we are is what I call enthusiasm. Some people call it passion, but I think enthusiasm is probably what I like to express. And enthusiasm has to be total and has to come from your heart and soul, a spontaneous heart and soul. And enthusiasm should be very strongly affiliated with positivity. And so people who see you working will see the positive vibes there. It's very important. It's very interesting to see that positive vibe in people who are working, who are with enthusiasm. And also enthusiasm, extends goodwill. So I think enthusiasm is a very important component of success in life. The third thing is that I would like to share with you is what I sometimes market as an image. Your credibility in the society, and this doesn't come in one day. It takes time and effort over a period. It's like a snowball effect, but has to be done properly, and it has to have a proven track record. And there's no shortcut. It's always woven with integrity. Credibility is very important. And I said integrity again is very important. All this together and the image that you have in your society, in your occupation is so important. It's so important. And this is something that I would like to share with some of the leaders, and even for people who are practicing in a small or a large scale. It's important that decision making is a very strong component of our daily life, and whether it could be making decisions at home or making decisions in large institutions, and all the bad decisions that the politicians are making now, whatever it is. Anyway, what I would like to focus is it's very important that we make correct decisions. And however, if you are sitting in a leadership, I would say more than 80% of correct decisions are very good. You don't make all the decisions correct, and but your majority of your good correct decisions with a good image track record will overrule that 20% that you have made mistakes. And taking risks is very important. It's extremely important to take risks sometimes. And if you are not taking risks, you are not a great leader. So you have to have risks, and sometimes please start thinking out of the box thinking. And the whole formation of Tilganga has been multiple out of the box thinkings and many steps, taking risks and moving on the top, almost at the sword's edge many times. Then decision making should be result oriented, of course. Yeah, but decision making is very important. And if you don't make decisions, you don't go up. The other thing that I really feel very important is team building. In team building, it's important that you have a shared vision with your team members. And the vision that you have, you should be able to share with your team. And as much of total sharing that you can do, as strong the team becomes. And it's important that because you have a shared vision and team who have developed ownership, there is strength and unity. Ownership is very important, and it's important that this shared vision, this team building, have a continuity, strong continuity, and continuity is very important for an institution continuity. And the other thing that I keep on saying is it's always very important that you have focus and, of course, willpower. And it keeps you on track, innovative details, results driven. Focus, if I like to share with you, many years ago when I was trying to dream surgical techniques that were that I could have make it affordable for a country like Nepal and still maintaining the quality. The focus was so strong that sometimes I vividly remember I used to dream about surgical steps. I used to have vivid images about the surgical techniques when I was eating when I was sleeping, when I was walking. So you need such depth of focus in the purpose that you're moving forwards. And this will really make you successful. Yeah. And once again, I'd like to thank everybody for having me as part of your annual meeting. And this is just a passionate vision that I have shared with you, with all my colleagues. And I'm sure your service to the country, to the people of Nepal, will continuously go on increasing. And all the best for the society's annual meeting that you're holding in Chitwan, I think. Thank you very much.